It is recommended to use Type HC healthcare facility cable in patient care rooms in a dental office. Type HCF cable is a plenum-rated cable designed for use in healthcare environments, including patient care rooms. It meets strict fire safety standards, including the National Fire Protection Association (NFPA) 99 Healthcare Facilities Code. Regarding hospital-grade receptacles, also known as Grade G receptacles, in most cases, it is not necessary to use them in patient care rooms in a dental office. Regular commercial-grade receptacles, Grade C receptacles, are typically sufficient for these applications. However, hospital-grade receptacles do offer some advantages, including higher durability and resistance to abuse, better electrical contact with plugs, electrical isolating features to prevent shock, and provisions for grounding and bonding. If the dental patient care room has equipment that requires a special power source, for example, oxygen concentrators or suction machines, it may be necessary to use hospital-grade receptacles in those specific locations. It is always advisable to consult with a qualified electrician to determine the specific requirements for a particular facility. The National Electrical Code (NEC) provides guidelines for electrical installations in healthcare facilities. These guidelines are designed to ensure the safety of patients, staff, and visitors. Article 517 of the NEC specifically addresses healthcare facilities. It outlines the requirements for wiring, grounding, and equipment in these environments. Type HCF cable is designed to meet the stringent fire safety requirements of healthcare facilities. It is typically plenum-rated, meaning it can be installed in air handling spaces without the need for conduit. This can save time and money during installation. HCF cable also has a low smoke and flame spread rating, which helps to reduce the risk of fire and smoke damage in the event of a fire. Hospital-grade receptacles are designed to withstand the rigors of a healthcare environment. They are typically made of more durable materials than standard receptacles and are designed to provide a more reliable electrical connection. Hospital-grade receptacles also have a number of safety features, such as tamper-resistant shutters and grounding contacts. In general, hospital-grade receptacles are only required in patient care areas where there is a high risk of electrical shock. These areas typically include operating rooms, intensive care units, and cardiac care units. In other patient care areas, standard receptacles are typically sufficient. However, it is always a good idea to consult with a qualified electrician to determine the specific requirements for a particular facility. When selecting receptacles for a healthcare facility, it is important to consider the following factors. Firstly, the type of equipment that will be plugged into the receptacle. Secondly, the location of the receptacle. Thirdly, the risk of electrical shock. And fourthly, the budget. The NEC also provides guidelines for grounding and bonding in healthcare facilities. Grounding and bonding are essential for preventing electrical shock. The NEC requires that all electrical equipment in a healthcare facility be properly grounded. This means that the equipment must be connected to a grounding electrode system, which is typically a metal rod or plate buried in the ground. The NEC also requires that all metal parts of a healthcare facility be bonded together. This means that the metal parts must be connected to each other with a conductor. Bonding helps to prevent voltage differences between metal parts, which can reduce the risk of electrical shock. The NEC also provides guidelines for the use of isolated power systems in healthcare facilities. Isolated power systems are designed to reduce the risk of electrical shock in operating rooms and other critical care areas. An isolated power system consists of an isolation transformer, a line isolation monitor, and a grounding system. The isolation transformer isolates the electrical system from the building's main power supply. The line isolation monitor continuously monitors the leakage current in the isolated power system. If the leakage current exceeds a certain threshold, the line isolation monitor will alarm. The grounding system provides a path for fault current to flow back to the source of power. This helps to protect patients and staff from electrical shock. In addition to the NEC, there are a number of other codes and standards that apply to electrical installations in healthcare facilities. These codes and standards include NFPA 99, the Joint Commission on Accreditation of Healthcare Organizations, and the Centers for Medicare and Medicaid Services. It is important to be familiar with all of the applicable codes and standards before designing or installing electrical equipment in a healthcare facility. It is also important to consult with a qualified electrician to ensure that the electrical installation is safe and compliant with all applicable codes and standards. The decision to use HCF cable and hospital-grade receptacles in a dental patient care room depends on a variety of factors, including the specific requirements of the facility, the type of equipment that will be used, and the applicable codes and standards. In general, HCF cable is recommended for use in patient care rooms in dental offices because it meets the stringent fire safety requirements of healthcare facilities. Hospital-grade receptacles are not always required in patient care rooms, but they may be necessary if the room has equipment that requires a special power source or if there is a high risk of electrical shock. It is always advisable to consult with a qualified electrician to determine the specific requirements for your facility. Several sections of the NEC are relevant to electrical installations in healthcare facilities, including patient care areas such as dental offices. Some key articles include Article 517, which covers healthcare facilities in general, and Article 517.13, which specifically addresses wiring methods for patient care areas. Additionally, Article 517.16 provides requirements for receptacles in patient care areas. Regarding HCF cable, the NEC does not explicitly define HCF cable. However, the requirements for wiring in patient care areas often necessitate the use of cables that meet specific standards for fire resistance, low smoke production, and insulation integrity. These requirements are typically met by cables listed for use in healthcare facilities, such as those complying with UL 13, the standard for power limited circuit cables. These cables are often plenum rated, meaning they are suitable for installation in air handling spaces, and they may be identified as HCF by manufacturers to indicate their compliance with healthcare facility requirements. When selecting cable for patient care areas, it is essential to ensure that it meets the requirements of NEC Article 517.13, which specifies acceptable wiring methods for these areas. These methods include the use of rigid metal conduit, intermediate metal conduit, electrical metallic tubing, and listed type MC cable that is continuously covered by a metallic sheath. The cable must also be suitable for the environmental conditions of the installation, such as exposure to moisture or chemicals. Regarding hospital-grade receptacles, the NEC requires that receptacles used in patient care areas meet specific performance and construction standards to ensure reliable electrical connections and reduce the risk of electrical shock. NEC Article 517.16 specifies the requirements for receptacles in patient care areas. It mandates that receptacles be listed as hospital-grade in patient bed locations and other areas where patients are likely to come into contact with electrical equipment. Hospital-grade receptacles are designed to withstand the rigors of a healthcare environment and provide a more secure and reliable electrical connection than standard receptacles. They typically feature a robust construction, corrosion-resistant materials, and a tight fitting plug interface to minimize the risk of accidental disconnection or electrical shock. While hospital-grade receptacles are generally required in patient bed locations and other critical care areas, their use in dental patient care rooms may not always be mandatory. However, it is often recommended to use hospital-grade receptacles in these areas as an added measure of safety and reliability, particularly if the room contains sensitive medical equipment or if patients are at increased risk of electrical shock. The decision to use hospital-grade receptacles in dental patient care rooms should be based on a thorough assessment of the risks and requirements of the specific facility. Factors to consider include the type of medical equipment used, the patient population served, and the applicable local codes and regulations. It is always advisable to consult with a qualified electrician or healthcare facility engineer to determine the appropriate receptacle type for each application. The NFPA 99 Healthcare Facilities Code provides additional guidance on electrical safety in healthcare facilities. NFPA 99 outlines the requirements for electrical systems in patient care areas, including the use of isolated power systems, grounding and bonding, and receptacle testing. While NFPA 99 is not a legally binding document, it is widely recognized as a best practice standard for healthcare facility safety. Many jurisdictions adopt NFPA 99 as part of their building codes or regulations. The code also addresses essential electrical systems, electrical equipment, and wet locations. The code emphasizes the importance of minimizing electrical hazards to patients and staff. It requires regular inspections and maintenance of electrical systems to ensure their safe and reliable operation. Electrical systems should be designed to prevent the interruption of power to essential medical equipment during power outages. This is typically achieved through the use of backup generators or uninterruptible power supplies. Wet locations, such as hydrotherapy areas, require special precautions to prevent electrical shock. These precautions may include the use of ground fault circuit interrupters (GFCI) and isolated power systems. Equipment used in wet locations must be listed for that purpose and must be installed according to the manufacturer's instructions. In addition to the NEC and NFPA 99, there may be local codes and regulations that apply to electrical installations in healthcare facilities. It is essential to be aware of and comply with all applicable codes and regulations. Local codes and regulations may vary depending on the jurisdiction. They may address specific requirements for wiring methods, receptacle types, and grounding and bonding. It is important to consult with local building officials and electrical inspectors to ensure compliance with all applicable codes and regulations. Understanding the specific requirements for HCF cable and hospital-grade receptacles in dental patient care rooms is crucial for ensuring electrical safety and compliance with applicable codes and standards. HCF cable is generally recommended for patient care areas due to its fire-resistant properties, while hospital-grade receptacles offer enhanced safety and reliability compared to standard receptacles. Consulting with qualified professionals and adhering to relevant codes and standards are essential steps in designing and maintaining safe electrical systems in healthcare facilities.